Welcome to Dallas Weekly's Health Edition. My name is Patrick Washington. I am the CEO and co-publisher. This week, we're talking with doctors Carolee Estelle, the Interim Chief of Infection Prevention at Parkland Health and Hospital System, and Dr. Vivian Johnson, Doctor of Pharmacy and Senior Vice President of Clinical Services at Parkland Health and Hospital System. Thank you both for joining us. So we're talking about COVID. Obviously, that's the big topic. And I'd like to first off talk about, our role as African Americans in this whole pandemic. And what has Parkland been doing to sort of address the African American community and when it comes to COVID-19 from your perspectives? And let's start with Dr. Johnson.
Yes. Thank you for inviting us to be a part of this. We have been doing quite a bit at Parkland from just a major campaign has taken place over several months. We are actually going out and doing town halls with the community. We are also, we've changed and updated our website to include a lot of information about COVID and how you go about registering to actually get the vaccine. We've also partnered with leaders within the community. For example, we had Emmitt Smith, an NFL player, to actually come and get his vaccine here and provided a PSA, provided information on why he felt that it was important to get a vaccine. We've had St. Marshall from the Mavericks. We've also had Martinez, the LULAC president, to actually be a part of this actually campaign as well. So we've done quite a bit to kind of partner with the community to make sure that we are providing the information that they are requesting and needing to actually really feel comfortable and informed about the vaccine.
Okay. And from your perspective, Dr. Estelle, how's the infectious disease department been dealing with this situation?
So in fact, well, I guess the Division of Infectious Diseases is the clinical arm, and so Infectious Diseases Group help a lot with taking care of the COVID patients. We've extended in a lot of different ways, rounding on multidisciplinary rounds with the intensive care unit teams and providing consultation for all of the many complications that can arise with the patients who have these infections. In my role as with the infection prevention program, our teams go out and do a lot of work. We help write policy, change policy, create policy and processes and flows to help prevent the spread of infection to both our patients and our staff here in the facility. And we've also done a lot of work to help partner with the community through Dallas County and the like, helping erect these testing sites and vaccination sites, making sure that that's done safely, and partnering with different nursing homes and facilities and helping them offer our assistance with infection prevention practices in those sites. And Parkland also helped with testing the staff and residents of multiple nursing homes and the like. So, and then, just like with the Dr. Johnson and the sort of community and media relations team, we help with provide sort of expertise at some of these community events where people have questions and the like at various events.
Yeah, speaking on that topic, we've heard a lot of information about nursing homes, especially in the African American community. Could you speak a little bit about how COVID has impacted minorities, especially Blacks and Hispanics, more so than white populations?
Yeah, so communities of color have been dramatically hit by COVID-19 in the last year and a half. So we have seen that not only are we getting it at higher rates compared to other communities, but we're also getting hospitalized and potentially and having increased death rates comparatively speaking. Black and Latino patients are 3 or 4 times more likely to get hospitalized from COVID compared to their white counterparts. And so this is very, very concerning. And these disparities, they play out in many other diseases, and they're multifactorial. There's a lot of reasons that they come about. And so COVID has just been one more situation that has highlighted those disparities.
And what are some of the social determinants of health, and how have these factors impacted Black people and Hispanic people in Dallas? And I'd like to actually turn that to Dr. Johnson.
Yes. Well, we consider social determinants more about the conditions that will impact, let's say, a person's health care. And so we're looking at things such as transportation or food, the economics, those types of things, their income, those types of things, whether or not people feel like they have enough to be able to actually really reach out and get the resources that are needed to actually improve their care. We have found that, for example, being a pharmacist, if people are not able to pay for their medications because of their income, that will impact their health. And so they're not able to actually treat the conditions because they're not able to get their prescriptions filled, or they don't have the transportation to go to their doctor's visits. So that's another issue that we may have, whereby patients don't have the resources, the social determinants, the social things that they need in order to ensure that their health care is optimal.
And staying on that point, so how is Parkland addressing identifying these people and since they're at high risk, and getting them tested, make sure they have information? How is that being addressed?
Well, first, because Parkland is considered a safety net organization, we have for a long time actually studied to determine where are the most vulnerable patients within the community. And so we have placed community-oriented clinics in those communities to actually, again, to improve access to care for our patients. With the COVID problem, what we have actually been doing, we have partnered with a group that's called the Parkland Center for Clinical Intervention. And that group works with Dallas County and gathers a lot of data about Dallas County residents, and therefore Parkland patients. We know a lot about where they live, their income, around their income, just whether or not those are vulnerable areas. And based off of that, when we know that we have patients who are at risk, then we're targeting our efforts. For example, we have drive-through vaccine clinics at Ellis, Davis, and at Eastville. Those are located near those zip codes where we've identified we have our most vulnerable patients. So that's why we've strategically placed them there, so that we can ensure that they have access to care.
Okay.
I just want to highlight a little bit, sort of piggyback on what Dr. Johnson said. Parkland has been a long-term partner in these communities that are marginalized and underserved and at risk, for a long time. That is what Parkland is here for. That is who our mission is. And so like she said, all of those clinics that exist, they were placed strategically to increase access into these communities that are underserved, that have less medical care available to them from an access standpoint, and where burden of disease occurs. During COVID, that was sort of heightened. Like she said, they worked with PCCI, the Parkland Center for Clinical Innovations, collecting data about where are the majority of these cases of COVID happening, creating geomaps of hot spots of infection, and used that kind of information to help decide where we put those testing locations, all the walk-up clinics, and which clinics are we going to have testing at indoors and the like when that happened. It's also that was also used to send push notifications out to people in those zip codes that were highly affected about, hey, just to let you know, COVID is very severe at this time. Here's where you can find resources, and here's what resources are available to you in your area. So a lot of work went into trying to do that. And then in the same token, vaccinations, when the vaccines became available, wanting to get to and reach these communities. And now it's been very difficult because of the logistical limitations that Dr. Johnson can talk about, with the temperature requirements and things for these vaccines that make it harder to go out into the public with them. But work using those tools has been important.
Yeah, let's stay on the vaccines, because now we're in the time of vaccinations, and that's sort of like everybody's new lotto ticket. I'm getting my second soon, hopefully.
Great, that's great.
Hey, I'm terrified of needles. I just want you to know that. Like, I'm talking heart palpitations, but I still did it.
That's great. Thank you for doing that.
Let's talk about the vaccines for a second. So obviously, I just want to hear your opinion about it, because I understand the importance. But what is the importance for everyone who is eligible to get vaccinated as soon as possible?
So I'll give mine. We have all heard about over 500,000 people have died from COVID-19 now. And so what the vaccines are doing, they have been shown to really help prevent hospitalization, help prevent death. And so that's why we feel that it is very important for everyone to get the vaccine, to reduce the risk of actually getting severely ill from this virus. And now that we have the variants coming out, again, that's why it's so important that we encourage others to get it, because we really don't know how this virus will actually affect you. Okay, you may hear now a lot of people may say, "Oh yes, I got it. I know someone who got it, but they weren't ill." That may have happened with that person, but the next person that may not be the case. But we do know that with the vaccines, it has been shown to significantly reduce the chances of you going into the hospital and having to be placed on a ventilator or dying from. So that's why we feel it's very important.
Mm-hmm. And so staying on the vaccine, I want to sort of veer to the left just a little bit, because we had on our platform the president of Dillard University, who was going through the trial vaccinations, right? Okay. And his backlash from the church community, from the Black community at large, about just misinformation that he had. And he spent a majority of his time correcting information that people just knew was true, to then, tell them the actual facts of what a vaccination, what a trial is, what happened at Tuskegee, and the like, right? And I want to kind of have you sort of speak about the challenges of getting this information out when there is a concerted effort to spread misinformation on a political level, on a federal government level. Can you speak a little bit and how that will affect African Americans in their homes with COVID in the future?
Patrick,
yeah. No, please go, Dr. Johnson.
Everybody don't jump on too quick,
No, we're very passionate about this. It's just because we know that there has been a lot of misinformation on social media about the vaccine. And oftentimes it's being shared by people who don't have the knowledge or experience. They haven't worked with the science or studied the data, but basically just saying that, the things that this vaccine will do to you. So yes, the Tuskegee experiment is something that you commonly hear is one of the reasons that people are hesitating. The Black community hesitates to actually get the vaccine. And it's true. It's terrible to know that that occurred. But the one thing I'd like to say, what has changed, number one, is that right back then, there was the men were not even being offered any type of treatment. Okay, now we know that there is a virus. We know what it can do to you. So there is treatment, or there is something that is being given to prevent you from getting that. That's one. Back in the before, we really didn't have, what I would say would be true representation from the community, and with actually being a part of the clinical trials. Right now, you know that we have an African-American lady who actually has been a part of actually developing the vaccine. In addition, you have to consent to actually be a part of trials. We have organizations that actually have to approve to make sure that these trials that are being done are safe before anyone can be enrolled. And I think now we have more representation within the profession that we can, like Dr. Estelle and I, we are out trying to share, we are reading the data. We would be able to help explain what actually happened within the study, so that we can go out and hopefully our community will see us as trusted messengers, trusted leaders to give the information on what is right, what is factual about the vaccine, and actually try to really correct the myths, those things that are not the misinformation that's out there about the vaccine.
Okay.
And I think you asked a lot of questions all wrapped into one. And I think it's very difficult to answer all of them at the same time, but I think it is important to sort of separate the trust issue from misinformation. And sometimes misinformation leads to trust, but some of the trust issues are related to facts, right? Tuskegee happened, Henrietta Lacks happened. Hundreds of women were, performed procedures without anesthesia. That's fact. Those are all true. Those all really happened. And all of that breaks down the ability to trust, these entities and the like. And so the way we work and rebuild that trust is similar to, we get information out, but it's not entirely the same as how we combat misinformation. And both of those are a huge component, and Black and brown communities and immigrant communities. And this isn't just a problem here in the US. These types of things have happened in other countries as well. Those communities that have been affected by those kinds of atrocities are not just fighting against misinformation, but also the historical and generational mistrust from past trauma. And so, we can't earn trust back in a day. This one conversation cannot fix that and cannot relieve all of those fears and uncertainties. But like Dr. Johnson said, there is a very big difference between then and now in terms of the ethical frameworks that we operate under, but the barriers that are in place to protect people, and especially to protect marginalized people when it comes to these clinical trials. Every organization has a human protection program and an institutional review board that requires them to go through all of these different hoops to make sure that the people in these clinical trials are being protected and nothing bad is happening to them. And these are things that did not exist at the time of the Tuskegee experiment, and the other sort of past aggressions. So it is really important to know that. And again, like Dr. Johnson said, people of color are at the table of these scientific discoveries and in these clinical trial executions. So Dr. Kizzmekia Corbett was one of the scientists for the mRNA vaccine technique. And we've got Black and brown physicians who are in the clinical trial sites being run all over the country, especially I know the Hutch and several of the folks there are people of color. And so it's really important to know that. The misinformation, we know that misinformation, it spreads much more quickly and more easily across social media platforms than facts, than truths. I don't know that there's a way to stop that, but what we can do and what we do is we put high quality, good information out and try to spread that as much as we can. That's why Dr. Johnson and I spend so many hours per week doing sessions like this, having community conversations with small groups, big groups, medium-sized groups, all, whoever wants to come can ask us any of these questions that they have. And so the name of the game is to get good information out there.
And we will be keeping that information available for anybody who sees this and wants to know more, just for the reference point. And so I'd like to now sort of not have like a rapid fire, but more so of like here's some questions about COVID and what's been going on that I think our community should answer. So I'll start with Dr. Johnson. Just recently, the Johnson & Johnson, stuff came out, the information about the potential blood clots. Mm-hmm. And I think that speaking to your point about, excuse me, trust, there's been a lot of conversations about it. So can you speak about the different vaccines and what might be safer than the other, or what are the differences? Like, that's a little bit muddy now since apparently everybody's focusing on Johnson & Johnson. But Pfizer has also had some developments in that they might think this might be an annual thing. And of course, Moderna is kicking strong with my wife not having to get another shot in 6 months, but my scared behind will. Can you just speak a little bit about, is one vaccine better or safer than another? And why is that?
So first, I'm going to say that, yes, there are several vaccines that are being studied, but right now we know of 3 that were approved to be made available to be administered. And I'm going to take out Johnson & Johnson right now because it's on pause around whether or not it's safe. We have a group now that is evaluating, and I'm going to talk about what was found. As you stated, there were 6 reports of women who developed this severe blood clot from it. And so, I mean, really, I think by having us to pause giving that vaccine, that's really what we should have done, just because we want people to feel that if something is not right, that it will be stopped. We're not going to continue to administer that medication. So I understand if someone who received the vaccine, Johnson & Johnson, would be concerned about that. What the reports show that those blood clots were seen immediately or shortly after receiving the vaccine. So because we've paused it, I don't anticipate that, we would hear that people would be saying that they're seeing it now. But if you've seen it, if you've taken the vaccine within the last 2 or 3 weeks and you start seeing things such as headaches or leg pain or abdominal pain, shortness of breath, those are the signs that you may need to then go to the emergency room, talk with your doctors about that. But for the most part, I would say that the vaccines are safe. Again, there's a process with the federal government, with the Food Drug Administration, that requires that there are different phases of all medications. So just like the vaccines, they are required to go through different phases to first determine whether it is a safe vaccine. And that was done with all of the vaccines, okay? And then there are different The next phase is just to determine what dose should we give. That was done. And then the last phase is really to see the use of that vaccine being used in a large number of people. And the Pfizer and the Moderna vaccine, they had over 40,000 people. And now that we've been given it even for longer, that number has increased. And again, both, they are actually made the same way. You've heard messenger RNA. That's what the Johnson & Johnson and Moderna vaccines are made with that technology. And so I consider that neither one is better than the other. They're both, in my opinion, just as effective, both of them equally effective.
Okay. And I'll get one more question and I'll turn it back over to Dr. Estelle. But what are some of the side effects of these vaccines?
So some of the common side effects that we have seen and have been reported in the study have been things that we see with a lot of the vaccines, and that is definitely the first thing that I had, and many have talked about, pain at the injection site, and maybe you remember that.
Yes.
Okay.
Yes, I do.
So pain at the injection site, very mild to moderate complaints about headaches, or also there are complaints about fatigue or chills after receiving the vaccine. But again, those usually go away after a couple of days. Okay. Again, I only had the arm pain. The studies have also shown, and we've heard people say that with the second dose, they usually see more side effects with the second dose, or they're more prominent with the second dose than the first. Okay. And so those are the types of things that we've seen with the data, and we've also heard patients actually say that they've experienced when receiving the vaccine.
And for our audience, all I felt was arm pain and fatigue.
So you did feel fatigue, okay.
Oh yeah, I felt the fatigue, but it wasn't that bad. All right. So Dr. Estelle, now moving back from the vaccines, and I've heard actually not just even recently that some people are still considering COVID-19 like a common flu. Could you please explain a little bit about like what long COVID is and what effective treatments could be for that?
So COVID-19 is the infection that we call, or how we call the infection that results from SARS-CoV-2 virus. And it is a respiratory virus. There's lots of coronaviruses out there that cause the common cold. And then there's these, novel coronaviruses that we call them, that have this potential to cause pandemics like we are experiencing now. Like the flu, COVID is a respiratory virus that spreads by respiratory droplets when we're talking or coughing or sneezing and spitting and things like that. And it causes respiratory illness. It causes cough. It causes shortness of breath. It causes fevers. How it's different from the flu is it's much more severe. It spreads much more easily and to a lot more people than the flu. So for every person who gets the flu, maybe they'll infect maybe one other person. With COVID, they'll infect probably at least two or three other people. And when you're talking about a whole population, that's exponential. That's kind of, the difference between COVID and the flu. And I'm sorry, I forgot what your other question was.
Oh, it's just some of actually, you know what? I'd like to continue down that road because you said something that triggered my mind. I asked the effective treatment, but I'll get into that in a second. Okay. Because of all you said, the spitting, the coughing and everything, the social distancing and the mandates that have, kind of been wavering. Why is it important for people to keep wearing the masks and social distancing, even though we have this vaccine out right now?
Yes. So it's important to continue distancing, washing your hands, and wearing a mask even after you've gotten the vaccine, if you're around other people who haven't gotten the vaccine or haven't finished their vaccine series, because the studies that were set up to evaluate the effectiveness of these vaccines, they actually weren't designed to evaluate if you could potentially get Sorry. They weren't set up to evaluate if you could spread COVID, if you maybe got if you were exposed to COVID after getting the vaccine, if you get a low level of virus that doesn't make you sick, which is the main objective of the vaccines, but could you still spread that? And we don't totally know the answer to that question yet. Now there is, this is being investigated, and some of the preliminary studies are really suggesting that it reduces that, but because it's still potentially possible to spread the virus even after you've been vaccinated, it's still important to continue masking, distancing, washing your hands to make sure that we don't spread it to other individuals.
And so I would imagine that from what we've seen about like spring break and these vacations for, let's say like young people, healthier people, what would you say to them who think like, well, I'm good. I've either had it, and I'm all right. I even have a cousin like that. What do you say to those folk? Like, because it seems to be that's not really translating what you just said.
Yeah, it's difficult. It's not over yet. I know the summer is upon us, the spring and summer and the warm weather is upon us, and we're sick of all that we've been through over the last year. But the reality is we're not out of the woods yet. And just like Dr. Johnson talked about, even though most people, especially most young people who get COVID, are not going to have a lot of symptoms. You're going to maybe feel like you got the cold. But some people will get very severe disease, and some will end up dying from it. And in addition to that, that risk of, we just don't know which young person is going to be the young person to get really sick from this. But also, whenever you get the virus, you have the risk of passing it on to someone that you love that is at risk of dying from it. And so it's still important, even for young people, to, be safe and cautious.
Okay, so, and finally, Dr. Estelle, this buzzword herd immunity keeps popping up. First off, could you please explain to our audience what herd immunity is? And are we even in the running to get to herd immunity in Dallas County anytime soon?
It's a great question. So herd immunity, or as someone once said that I admire, community immunity. What we're shooting for is everybody in our own communities to be immune to this virus so that they don't get it, so they don't get harmed by it. And that's what sort of it means. And so each virus, like we talked about how flu spreads to one person, for each person with sickness, COVID, each person can spread it to 2 or 3. If you come in contact to 5 people with COVID and 4 of them or all 5 of them have immunity, you can't spread it. The infection ceases to spread. If half of those people have immunity, then it's much less likely to continue spreading. So the goal is to stop this infection from being able to harm such large numbers of people in our community by giving their immune systems the knowledge of what this virus looks like and how to attack it inside of their own bodies.
All right. And are we in Dallas County anywhere near herd immunity at all, please?
It's a great question. So for the country thus far, the word is that we are up to 30% of the adult population has received at least a dose of vaccine. And in Dallas, we are pretty close to that. I think we're at a quarter or so of the adult population has received a dose. And as I recall, for the statewide, we have for seniors, for those over 65, we've actually vaccinated about 50% of those individuals.
Okay, and speaking of that, Dr. Johnson, how many doses does that equate in Parkland? How many doses of vaccine has Parkland administered?
We have given about 255,000 doses of the vaccine at this time. Now, a portion of those have gotten both doses, and some just one. But total, we've given about 255,000 at this time.
And is the vaccine available for children?
Not at this time. There are trials that are underway to actually where children are actually enrolled, and we're hoping that within the 6 months or by the fall, we will have approval to actually give it to children. But right now, that it is not approved for use in children at this time.
Okay, well, we will be on the lookout for that. I do understand that y'all have a bunch to do, and so I won't take up any more of your time, but I do want to thank you for joining me and giving me all this information about COVID in Dallas. We will have more information about this throughout the week, and of course on our website, we will have links to places you can find out more information and where to get testing. So Dr. Carolee Estelle and Dr. Vivian Johnson, thank you both for your time and your service to our community.
Thank you.
Excellent. Thank you very much. Also, one other thing, just piece of information I want to make sure you guys include is the free walk-up vaccine clinic for Parkland at Ellis Davis Fieldhouse. I'm not sure if you guys were given that information. It's not really a walk-up, it's a drive-through, but every Monday through Saturday from 11 a.m. to 4 p.m. you can drive up to Ellis Davis Fieldhouse at 9191 South Polk Street, and you can get your a COVID vaccine without an appointment.
Okay. We will also add that, and we will of course put that on the mobile app so we can push it out to those who are on our text thread. So thank you again. And for those that are watching, we will be back tomorrow with our segment on HIV/AIDS.